We're still coming through the peak, and this is, as I've said before, a delicate and dangerous moment in this crisis. So I know that a lot of people have made a lot of sacrifices, which is why it's so important that we don't let up now and risk undoing all of that hard work. Now, we are working on all of the potential options for a second phase. There is light at the end of the tunnel. Whether you're an NHS worker on the front line, working tirelessly, shift after shift, or a parent at home with young children. But we do need to be patient, and we need to be careful as we come through what is a moment of maximum risk. So we'll wait for SAGE's next review of the data in early May. We're ramping up the testing with capacity now at over 73,000 per day and 52,429 tests carried out per day. And eligibility for those tests has now been expanded again further to include anyone who needs to go to work but can't work remotely and who has symptoms. It also includes anyone over 65 with symptoms and all care home residents as well as care home staff. And at the same time, as we ramp up the testing capacity, we'll keep working on our tracking and tracing capability, which is going to be a key component in the next phase of this crisis. We'll continue to source ventilators and personal protective equipment, both at home and abroad. Paul Dayton is leading the national effort to increase domestic production and supply. We continue to source PPE from abroad. We're setting ourselves out as the international buyer of choice in the international marketplace. And I can tell you that in the last 10 days, we've secured over 5 million masks from China. We've had 3 flights with gowns from Turkey, because we know that every single one of those items of PPE is needed by those working so hard on the front line, both in NHS and also in our care homes. Since the outbreak in Wuhan, we've helped an estimated 1.3 million British nationals return on commercial flights. And we've done that by working with the airlines and with those governments to make sure that the flights can run and that the airspace is left open. And we brought back over 200,000 British nationals from Spain, 50,000 from Australia, and over 11,000 from Pakistan, to name but just 3 countries. As well as those commercial flights, we've also chartered flights where commercial options were not possible. And we've now reached a stage where we've brought back over 20,000 British nationals on 21 flights. So that was an enormous effort, and we recognise that the job isn't yet done. We'll continue with this unprecedented effort, with further charter flights coming back from New Zealand, Pakistan and Bangladesh, amongst others, over the next week or so. The Health Secretary announced last week that UK trials have started as we draw on the incredible scientific talent that we've got in this country to pursue a vaccine. And that effort too has an international dimension to it. So today we announced that the UK will provide Gavi, which is the International Vaccine Alliance, with the equivalent of £330 million each year over the next 5 years, as we seek to come up with a vaccine both to protect the British people, but also to help immunise millions of the poorest and most vulnerable people right around the world.